So there still are safety nets in place.
Right, there's limitations.
When we look at legislation like that will affect the cost of health care, specifically, how would that affect the cost of health care, and who are we talking about when we talk about Texans and their affordability versus accessibility?
Well, I mean, right now we're looking at, there's a lack of access to medical care, especially in rural areas. A lot of that can be because of the restrictions that are placed on the nurse practitioners or advanced practice nurses. There's delays in treatment because a lot of times physician practices are full. They have a long wait for appointments, longer wait times. Patients aren't being seen. I can give you a specific example. I currently work in a neonatal ICU, and we have a lot of babies that get discharged. A lot of them are Medicaid, and we call and try and get these babies in to be seen for their follow-up appointments, and there's no physician. There's a shortage. There's no physician that can take them, and they're being referred to the health clinics.
Free clinics, quote, free clinics that we pay for with our tax dollars.
Right, that aren't exactly free.
They're not free. So when we talk about that type of issue, how would this? So we're talking about folks that could be seen by a doctor not in an emergency setting, because that's another issue.
They go to the emergency room.
Well, because
for common things, like cold and sore throat, or the baby, has.
But in many cases, if they were in a position to get preventative medicine rather than, I guess, crisis medicine, let's call it,
you'll see a decrease in healthcare costs.
So, because it's not probably the most expensive medicine we can buy is emergency room care, because we're beyond the preventative. We've got an issue, and now we've got to get it under control.
And they don't have a physician. I mean, they'll come in and you'll ask, in the emergency room, who is your physician? Well, I don't have one.
So
they come to the emergency room, or they go to a clinic.
And I think a lot of folks don't understand when we talk free clinics that we're talking about tax dollar paid health care.
Exactly. I mean, that's true right there. One of the when you talk about rural areas, though, you're still getting to that point where there's not enough people in the rural areas to make anybody a living out there. As most of the times, there's two different kinds of rural areas. There's Orange County is a rural area, and you've got good health care here. You have a nice hospital. You have doctors' offices out in different parts of the areas. There's some Mauriceville, some Vidor, some Bridge City. This rural area is pretty well taken care of. You get to the rural areas where there's 500 people in the whole county. That's a difference. There's a big difference there, because it's hard to make a living there, and it's hard for anybody to be sick there too. I mean, when you're talking about 500 people, if they're sick once a year, I mean that's one person you'll see a day. I mean it's hard to make a living, or even justify having somebody out there for somebody one day a week. And usually, sometimes they're going to be there. Okay, we're going to be here on Tuesdays. Well, I've never been able to be sick on a special day. Yeah, well, I'm not going to get that flu until next Tuesday, because the doctor's going to be here.
When I worked in industry, I mean, I saw a lot of people scheduling an illness.
Well, that's different. There is some scheduling
flu
things.
6 months in advance.
Yeah. So
I'm going to be sick next week, so I'm going to go ahead. You need to schedule overtime.
Yeah, go ahead and schedule
it.
And
Bucky, I had a question. For whether you call it the Affordable Health Care Act or Obamacare, a lot of people who have chimed in are either people who are politically oriented, people who are in the state legislature, but you very rarely, at least in the debate for passing Obamacare, you didn't really see a large part of the medical industry chiming in, or at least you didn't see them that vocal. It'd be interesting as people that are going or just starting their medical careers, what sort of opinions you have on this.
I think with providers already in short supply, the new healthcare reform is only going to increase provider demands, and it can potentially lead to lower standards of care. And as Melissa said before the break, it's going to lead to longer wait times, not only to be seen by the physician, but, once you are in the office, you're going to be waiting for a long time.
And also, you have patients that are living longer with more illnesses and chronic conditions, and there's not enough physicians out there.
So we're looking at a stress system right now in terms of healthcare providers already, and then you're saying that you see an increase.
Right, there's going to be more stress, and nurse practitioners can actually help fill that gap. We're registered nurses with graduate school education. We've been trained and prepared to provide excellent primary care.
And, in relation with being under the collaboration of a physician, they're only allowed at a maximum of 4, being able to look over 4 nurse practitioners at a time. So even if there's a ton of nurse practitioners out there, we're still having a decrease in the number of primary
physicians. So you're going
physicians.
to have more primary physicians in
to
order
oversee
the
nurse practitioners.
Unless this gets changed.
All right, well, okay, so you guys didn't say it, but as a Democrat, I'm going to say it, so it doesn't sound like the Affordable Health Care Act is a job-killing bill at all. It sounds like it's going to create jobs.
Well, I tell you, I'm gonna chime in. I'll tell you, there are some good parts to it, and there's some decent things to it that are good that should have been done a long time ago, especially bringing your illnesses over to one insurance company to another, protecting folks. One of my big concerns about the whole thing is that right now you're going to be paying roughly about $2,000 a person if you don't have insurance right now. What's going to happen? I think one of the problems you're going to have is right now a corporation is probably paying $6,000 or $7,000 a year for a person to have insurance, and if it comes to a point to where they're going to close the doors down or move everybody over to state health or federal health insurance, I think they're going to move people over to federal health insurance and save themselves $4,000 or $5,000 a year in savings. The savings, to the people I just don't think it's going to be there. The doctors, whether you're a nurse practitioner or a doctor, you still have to pay for electricity. You have to pay for the paperwork. You have to pay for the phone lines. You have to pay for all the parts of business that is there. And where a nurse practitioner is going to charge less than a doctor, that's probably true in that sense, but they still have to make a living, and they still have to make money off the top to make a living.
Why aren't we looking at a balance in funding, recognizing the geographic issues of Texas and the fact that when
well, we do have some, we do have programs in the state of Texas right now. For instance, the doctor that moved out to Mauriceville, when he came out to Mauriceville and came into a rural area, the state of Texas paid for his medical. They paid for his medical schooling. They paid for his helped pay for his building in low interest rates to build a building. All that stuff right there with a signed agreement that he was going to service a rural area for X number of years. We have those kind of agreements throughout the whole state of Texas. The problem is it doesn't matter how much you give a doctor, he's still not going to go to that county that has 500 people in it, or that city that has 500 people, because it doesn't matter if you give everything free to him, he's not going to make a living. So you have to, some of the rural areas of Texas are just not going to get served.
So we're going to have to look at a balance, which is going to involve a compromise, recognizing that we're currently paying for those healthcare services through free clinics paid by tax dollars, or emergency room indigent care programs subsidized by tax dollars.
And we are, but how many of those people, if you give those people right there that are on indigent care or that are using our emergency rooms and everything else, a lot, the perfect thing is to be preventive medicine. it's always better. If you go to a dentist 3 times a year or twice a year and get your teeth cleaned and get everything fixed and done, your teeth are going to live a lot longer than at the end. It's the same thing as if you get your body fixed and get checked up and work on it and exercise and eat right and all these things are not going to happen to you as much. But as Americans, we don't choose to do that a lot of times. We don't. I mean, I've had 2 heart attacks already, and now I'm just starting to work out. And it's one of those things that you can talk preventive medicine all you want, but a lot of people won't exercise preventive medicine. And then who's going to pay for it? If you get these people that are going to the emergency rooms right now with a sore throat and everything else, they're going to those emergency rooms because they know they get it free. They know that they're not paying for anything, and so but they're not going to pay $20 a visit to go to a wellness center or to go to go work out or whatever they need to do to fix themselves and to get ready. Those people are not going to do that.
All right, back over to the ladies from UTMB. You've heard all of this discussion. Out of the whole how you get laws passed, what's happened here with the bills that didn't make it through, one Biden calendars, what would you like to see? What do you want to see happen? How do we make this happen as a society?
Well, we want to encourage medical professionals, elected officials, and constituents in the state of Texas to support an agenda that puts patients and healthcare first by supporting full prescriptive authority for nurse practitioners in Texas.
And that'll save dollars and increase accessibility.
Yes, absolutely. And then the nurse practitioners can also go and practice in those rural areas where the physicians don't want to go. They can actually serve for rural areas.
Through the conversation, what I'm understanding is we all agree that preventative health care is cheaper than emergency health care.
And it is, but it's also a thing of choice. And I think too, a lot of things are people have choices to make, and it's great that we have choices to make. And if you want to go to a nurse practitioner, there's a lot of people that don't understand what a nurse practitioner is, and they don't understand what that is. But they want to see that doctor. They don't.
You're filibustering on me.
No, we're not filibustering.
But my point is that if we agree that preventative health care or wellness programs would be better for society and cheaper.
It would.
But
who's going to pay for it?
We're continuing to pay for the most expensive medicine known to man through the emergency rooms, but we can't seem to get over to the preventative. And
because the preventative part is going to be is expensive too. It's not cheap to do the preventative part.
But it's going to actually decrease in the end, because once you've got the preventative going, you're not going to see all the emergency room like it happened before. Once you've got people going and doing preventative health care, if you give it to them for free, they do the preventative health care, they're not going to need the emergency room down the road.
But how many of these people
it's going to be a lot cheaper.
How many of these people that, even if you gave them free preventative medicine, how many of these people are actually going to do it? How many people are actually going to make an appointment with the dentist 3 times a year? Or how many people are actually going to go to this wellness center and work out? If I give you a free workout program and say to everybody that's on indigent care right now, here's a gym right here that you can work out in. I want you to work out 3 times a week in this gym. How many people are actually going to do it?
If you give people the right motivation, and let them know the rewards of it,
what is the right motivation?
Well, see, now that's
it. You have to find the hook.
You
have
to find the hook.
Give us the hook and we'll do it.
That's it.
That's where we need to
with
be
a lot of the
talking
people,
about
it's their children. It's like, okay, well, you have to go set the right example. So you're telling people, okay, you go get healthy and get your children healthy at the same time. That's one hook. Another hook could be rewards for people. It still would be cheaper than a lot of emergency health care.
Well, what's a bigger reward than taking care of yourself? And if that's the question is if
we have both,
if wellness is better than
we have both financial and social mindsets, and we